Hi, everyone. This is Will Haskell here from Ivy Rehab Physical Therapy. We are joined by a special guest today, Dr. Grant Garagos, shoulder and elbow specialist out of Midwest Orthopedics at Rush. Dr. Garagos is here. He's going to answer some questions for us today pertaining to the COVID 19 pandemic and how our patients can receive care. Dr. Garagos, thank you so much for being on today.
It's a pleasure. Thank you for having me.
So, Dr. Garagos, given the scarcity of resources and medical personnel during the COVID 19 crisis, should people be limiting their activity? Should they be staying indoors, not doing anything, riding their bikes, going on skateboards, playing basketball, etc.? Because if an injury arises, can they still come in and receive orthopedic care?
So I've heard the same concern as well, and it's just not necessary. First of all, being active has so many health benefits. You really don't want to throw those away just because the rest of your life has been turned upside down. It also has a lot of psychological benefits, right? So, what better way to keep your mind off what's going on than to have a healthy outlet like staying active? A
Sure.
second, the risk of injury if you stay active is relatively low. So, we're not talking about extreme sports here. We're just talking about, going out and doing things around your home. So, and third of all, here where we are here in Chicago today, it's 70 degrees. It's the nicest day of the year. So, obviously, you want to be smart about it. You want to practice social distancing. You want to follow all the rules of your state and your country and your locality. Um, and obviously the rules about collecting in parks, et cetera, et cetera. So I'm not saying don't follow the rules, but within that construct, I think I would encourage everyone to be active, whether it's around their home, on their own property, just as long as you're not having close contact with others. You still want to maintain a healthy, active lifestyle.
Oh, that's great. And since most emergency rooms, urgent cares, walk-in clinics right now can be limited in terms of their availability, under what circumstances or what types of injuries should we be reaching out to you first as a primary point of contact?
Yeah, that's a great question. I think that's the key point of this whole conversation. And going back to your first question, is we're here for you. So if you are active and you do get hurt, just because people don't want to go to the hospital, they're worried about healthcare resources, et cetera. Our outpatient orthopedic clinics have fewer patients than ever, and that's in response to these issues that we are facing right now, and our maxim for social distancing. But we are here for you. The way we do it is with telehealth. So you would contact our office. You could go to my website, drgshoulder.com. You could call my group, Midwest Orthopedics at Rush, and ask for me if you have a shoulder problem or ask for one of my partners. You can access an orthopedic provider, and typically we're screening all patients with telehealth. So the way that works is similar to how I'm speaking to you on your computer, a tablet, or phone right now. We'd have a conversation, and I'd be able to kind of hear what's going on, hear how you hurt yourself, watch you do range of motion, et cetera. And then basically we can get a fair amount of information. Now, obviously, we don't have the x-rays. I can't lay hands on the patient there, but there's a lot we can glean. And certainly that's a good starting point. Now, if the patient then needs some kind of in-person visit or imaging or physical therapy services, those can absolutely be arranged. So we do see patients that are deemed necessary through our telehealth screening, and we do that all the time. So all the providers in my office at Midwest Orthopedics at Rush are still coming in. We're obviously on very reduced hours and doing it in a very specific way. Everyone's wearing masks and gloves and having their temperature checked, et cetera. We're only seeing the patients that need to be seen. But if you need to be seen, you need to be seen, and that's the bottom line.
No, that's great, and those are excellent points to make. Now,
Mhm.
so if I'm scheduled with you and say we do a telehealth visit and you tell me, hey Will, once this ends, I feel like you're going to need surgery. What can I do in the meantime if my surgery is being pushed out for months because of all the things that are being delayed right now?
Right. So there's a couple things that are going on here. So the indications for seeking care are the same. So if you feel like you have an injury, pain, or problem that's bothering you enough that you want to reach out to a physician, it's the same as before the COVID pandemic. The only difference being the way we do it. So with telehealth being the screening tool and being trying to provide some recommendations through that option. And the same thing for treatment. If you need treatment, you need treatment. We are still able to do urgent orthopedic and certainly emergent orthopedic injuries can be treated. So if you fall and you break your bone, or you fall and you have some kind of tendon tear that would need to be treated within the next 4 to 6 weeks, while we think this will be under these current restrictions, that absolutely can still be treated in the same way. Along the same vein, we can still do injections. Again, that would require an in-person visit, but that can be done in a safe and effective manner. And then lastly, the mainstay of what we do that does a lot of the heavy lifting is physical therapy. And again, that hasn't changed at all. So patients can still see a physical therapist. Obviously, it's done in a different way, a little bit, and you can probably allude to that more than I can. And then obviously, a lot of it is done in teletherapy, just like telemedicine. But again, the same algorithm applies. So if you need treatment, whether be it injection, non-operative treatment, or surgery, we still do the same things. The only difference being if it's a purely elective surgery. So if you have a chronic degenerative condition that is not likely to worsen if not treated in the next 6 weeks, well, obviously it would be unwise to proceed and against our policies to proceed within the next 6 weeks. So that's the only change. If you have an urgent condition or an injury that's likely to get worse over the next 6 weeks, we would still treat you, be it surgically or non-surgically, as if there was no COVID pandemic.
Oh, that's great. And Dr. Garagos, lastly, what's the best way to get in touch with you if I need to be seen by you, either in the clinic or via telehealth?
Yeah, so my website is always available as a point of contact. There's a lot of useful information on there. It's www.drgshoulder.com. That's drgshoulder.com. You can obviously contact my office at 312-432-2880, 312-432-2880. I'm a shoulder and elbow specialist, so if you have a joint issue or some other problem, certainly you can call our main Midwest Orthopedics at Rush appointment number, which is 877-MD-BONES, and they can put you in touch with a provider that would be a specialist in a different area of the body.
Oh, that's great. Dr. Garagos, thank you so much for your time and this information. It is incredibly helpful to hear this from such a great provider in the area, and we certainly thank you for your time.
It's my pleasure. If I can leave everybody with one thing, it's just to know that we're still here for you as physicians, and we're still able to interact with you. If you feel like you need to be evaluated by a doctor, do not hesitate. The telehealth option is a fantastic option that you should utilize if you need it. So thank you for your time and thanks for your attention.
Great. Thank you so much, Dr. Garagos.